In the next 10 to 12 minutes, you will hear us summing up, and then we will vote one further time. And our first panelist to begin his 2-minute summary, John Stossel.
If you think health care is expensive now, wait till you see how expensive it is when it's free. When it's free, there are no controls. I don't think this side is saying the American system is a good system. It's not a market. We're spending other people's money. Government is already involved, spending about half the money. Third parties pay for $7 out of every $8. This is an awful way to pay for things. Think how it would work if your car insurance worked that way. If they paid for your gas and your oil, you wouldn't care what gas costs, and people would sell you $100 oil changes. That's what's going on in health care under insurance companies paying or the government. And employment-based insurance makes no sense when 4 out of 10 Americans change jobs now every year. Government is not the answer. We don't have government steel mills or government airlines anymore because they were awful. And once they had competition, they went out of business. Michael says medicine's different, but every profession says that. The truth is, it's true, you're not an expert, you don't know which doctor's the best, but you don't know which car is best. You're not car engineers, but through word of mouth, the good news spreads, the bad companies go out of business, the good doctors will take over. And we see this now where there is a market, the tiny places like cosmetic surgery, LASIK eye surgery. The doctors give you their email addresses. Does your doctor do that? They give out their cell phone numbers. The waiting rooms are nice. And the prices are going down while the quality is going up. The post office can never give us what FedEx can.
Thank you, John Stossel. Speaking for the motion in his summary, Paul Krugman.
In the course of this debate, I actually felt, I don't know whether the audience will agree, but I actually felt that John Stossel, in effect, conceded when he held up that Trabant at the end of it. Because that just shows, if all you can do is say, communism, communism, East Germany, I don't want us to move to East Germany. I just want us to move to France. Now, look, government health care is imperfect. Actually, government health care is not the issue. Government insurance is imperfect. So is private insurance. There are horror stories. The nature of health care is that lots of bad things happen. You don't generally seek health care because you're feeling great. But we have extensive experience. We have Medicare, which is a system that is flawed, but has actually shown slower cost inflation than private health insurance over the past 40 years. We have the Veterans Health Administration, which is our little island of true socialized medicine in the United States, and does very well. And above all, what we have is a system right now. Remember what the proposition is. The motion is that the federal government should guarantee health care. Not that the government should run everything, not that everything should be under government control, not that we should nationalize the steel industry, which keeps on being raised, but it's not on the agenda, or nationalize the auto company, but whether there should be a federal guarantee of health care for everybody. And that, I think, is something that American values, that our fundamental morality says is something we should be doing.
Thank you, Paul Krugman. In making her 2-minute summary against the motion, Sally Pipes.
Although it would be nice if the federal government could solve all of our healthcare challenges, current events both at home and abroad show that it cannot. As a Canadian, I watched firsthand the promise of free healthcare, and I saw it devolve into the reality of a high tax bill and long lines for advanced care. As waiting lists grew over the years to more than 4 months in 2007, an increasing number of Canadians have traveled to the United States for treatment and paid out of pocket, whether it's Mayo's, the Cleveland Clinic, or UCSF system. The number of illegal private clinics in Canada has grown significantly over the last few years. The government is afraid to shut them down, even though private health care is illegal in Canada, for fear of an immense outcry. In June 2005, the Canadian Supreme Court ruled in a monumental decision that the ban on private health care in Quebec is illegal. Quebecers are entitled to life, liberty, and the security of the person. Long waiting lists do not give you that security. Madam Chief Justice Beverly McLaughlin said, access to a waiting list is not access to health care. Claude Castonguay, chair of a Quebec Royal Commission on Health Care in the 1960s, recommended that Quebec adopt government health care. The Quebec government followed his advice, and they called him the father of Quebec Medicare, just like Tommy Douglas, the father of Medicare. This year, he released a report, an official government report, evaluating Quebec's ailing healthcare system. His conclusion, it's in crisis. He now urges legalization of private health insurance. Americans believe in freedom and personal responsibility, not big government. They don't want big government controlling our lives. The question is, who do you want to control your healthcare decisions? An HMO bureaucrat, a government bureaucrat, or you yourself? By supporting universal choice in healthcare and empowering consumers, we will achieve universal coverage. Thank you.
Thank you, Sally Pipes. We're next going to hear from Michael Rachlis. Michael Rachlis is a physician and health policy analyst, the author of Prescription for Excellence, How Innovation is Saving Canada's Healthcare System. Michael, your 2 minutes begin now.
Yes, I want to mention that there is virtually no flow of Canadians south of the border. The Canadians getting health care south of the border are like 99% of them are like my daughter who had a catfish spine through her palm. People on vacation. There is the waiting list issue. I mentioned that it is a problem in Canada, but other countries with universal systems don't have waiting list problems. It is not a problem of universal coverage. And in fact, in Toronto right now, because of public response to the concerns about waiting lists, if you need cataract surgery, if you need your knee replaced, if you need a hip replaced, phone one number. You can be seen in an assessment clinic within 1 week usually, and you can get your surgery within a month after that. And it doesn't cost you any money directly because you pay it in your taxes. And the taxes in Canada as a share of GDP are almost as low as they are in the United States, and we've had surpluses for 11 years. I think what you're hearing from the other side are a whole series of anecdotes, and yet the overall research indicates that every other wealthy country in the world where you would feel comfortable visiting and living has universal system. And I think what you really have to watch out for is what the New Yorker commented on April 20th, 1992, referring to then the first President Bush. The compulsion that derives President Bush to distort the facts about Canadian healthcare suggests that official American policy is in the process of becoming what conservatives in discussing the Soviet Union used to call a total ideology, a system blindly convinced of its absolute truth and yet so fragile in its relationship to reality that it is incapable of considering even the most obvious reform. Surely we should have learned by now what happens to ideological systems that begin to deny facts that their people can discover for themselves just by crossing a border. Cross the border, come to Canada. Anybody in the audience, contact me. I will show you the Canadian healthcare system. And then America should do universal coverage in its innovative fashion. Make healthcare a right, and then do it right.